What do we mean when we say peer support? Peer support is when someone with specific lived experience provides support to another person who might be going through something similar. Lived experience can mean that they have been impacted by systems, such as accessing mental health services for themselves or for their child, or involvement in juvenile justice or other systems, which is why sometimes we also use the phrase systems impacted. All peer support providers use their lived experience and specialized training to benefit other people, and along the way help inform and improve services for children, youth, young adults, and families. This might look like listening, sharing experiences, helping someone amplify their voice, finding resources, identifying goals, or navigating complicated systems. But the most important part? It's built on trust, empathy, and shared understanding. Peer supporters work in various settings: mental health care, substance use programs, hospitals, crisis response teams, juvenile justice, and more. Their skills are valuable across all levels of systems. They may work within a team-based program or provide individual support. The work they do is not clinical in nature, but enhances and supports the work of other professionals involved in the life of a young person needing support, and their family for better outcomes for all. We know that peer support works best when people share common experiences and roles. However, it's important to understand the differences as well. While there are similarities in types of peer support, their roles vary based on their own lived experience and systems they operate. Each peer supporter receives training and supervision specific to their roles. Let's talk about two of these: youth and young adult peer support, and parent peer support. A youth peer support specialist is someone ideally near in age to the youth they are seeking to support. They use their lived experiences as a youth receiving services or having to navigate disruptions due to mental health, substance use, discrimination, or other challenges. By sharing their stories, youth peers help the young people they support find balance in treatment, school, and self-advocacy, empowering them to use their voice and choice to take charge of their care and drive systems change. One of the most important elements in being a youth peer support specialist is affirming what the young person wants, not necessarily what the caregiver, doctor, system professional, or even you thinks is best. Young people often lack agency and autonomy in their lives, so knowing that you support their voice and choice is critical. A parent peer support specialist draws from their experience as a primary caregiver who has navigated services for their child with mental health challenges and their family. They understand the challenges and complexities of accessing mental health care, coordinating with schools, and balancing treatment plans, all while supporting the entire family. Parent peers offer validation and support caregivers to connect with resources, build skills, and be effective advocates in their child's care. They also guide professionals in better engaging with families. At the heart of parent peer support is non-judgmental acceptance, focusing on a caregiver's strengths, helping them find what works best for their family, and providing hope that they and their child can thrive. All types of youth and parent peer support are essential to a comprehensive system of care, playing a critical role in achieving positive outcomes for children, youth, young adults, and families.